New COVID infections have been on a downward trend in Korea over the last 2 weeks. And starting tomorrow, COVID-19 will be recategorized as a level 4 disease, the same as flu. Our Choi Soo-hyung explains what's changing.
With COVID-19's infectious disease categorization being lowered from level 2 to level 4, a care system similar to that for influenza is being implemented within the general healthcare system. Infectious diseases are categorized into different levels based on their risk of spreading. When the coronavirus was first detected here in January 2020, it was classified as a level 1 disease, a highly contagious infection, or one with the most risk of spreading. Just over 2 years later, on April 25, 2022, the government declared it a level 2 disease in the same grouping as tuberculosis, measles, and cholera, and after another year and 4 months, level 4 like the flu. The most significant change is that there will be no more daily reporting of confirmed cases numbers. Instead, the government plans to operate a more precise monitoring system to observe COVID-19 trends on a weekly basis. The system will be operated through 527 monitoring agencies, and starting on September 13th, the disease status will be announced every Wednesday. Additionally, rapid antigen and PCR testing conducted at doctors' offices and screening clinics must now be paid for. Mandatory mask wearing at high-risk facilities such as hospitals and nursing homes for the elderly will continue, as will the recommended 5-day isolation for confirmed cases. Even with the transition to a level 4 infectious disease healthcare system, vaccinations will still be available free of charge. The government and healthcare experts strongly advise getting vaccinated, highlighting that an annual shot will effectively reduce mortality and severe illness rates among high-risk groups.
Obviously, in protection of ourselves, vaccination would be strongly recommended if a person has not gotten yet. What I've noticed more commonly recently is that people who come in with rather relatively higher or severe symptoms, they tend to have not yet experienced COVID, or they have not received vaccinations.
The government plans to maintain a direct COVID-19 response team at the Ministry of Health and Welfare instead of relying only on administrative agencies in the case of a possible winter resurgence. Choi Soo-hyung, Arirang News.